Without the United States and international community moving in to help and build the structures and help the healthcare system, how capable would these countries have been to deal with this issue? How indispensable is the United States, in other words, in dealing with this issue?
The U.S. has obviously had an indispensable role, and very importantly, to helping with the logistical response, funding the many non-governmental organizations who deployed healthcare workers to meet the need. But even more importantly, as a signal of commitment to the rest of the nations of the world that this was an important problem that needed to be solved, because we can't go it alone. This is obviously something that affects the world community.
So if there are, which there will be, additional Ebola flare-ups, Lassa fever flare-ups, what is the capacity for these countries to deal with it in the absence of the United States being there to provide assistance?
Well, I mean, you've seen how poor the West African countries are. Other countries have more resources to be able to mobilize on their own. But unless we as the United States government are creating better incentives for governments to put their own money towards basic public health programs, disease surveillance, healthcare workers, infection control, results in health, I don't think we will get to sustainability anytime soon. So I think that's something that we need to think about going forward.
So we will have to be there in order to ensure that when these flare-ups occur, that the problem is contained quickly. Is that what you're saying?
So far, the United States seems to have been the first responder in many cases.
And that will have to continue, in your opinion?
In low-income countries, I think that will have to continue.
Yeah, thank you. And what about the survivors? They're particularly vulnerable. What kind of additional assistance will they need in order to be able to deal with the aftermath of their families being afflicted with this disease?
I can take that. Senator Markey, what's needed is good health care. I mean, you brought up in your opening remarks that the survival rate for people with Ebola in West Africa was dramatically lower than it was for people that were brought here. They had the same disease, but they had different healthcare systems. So what we need for Ebola survivors is ongoing care. A number of them have ophthalmological or eye problems. Of course, there is the potential for the disease to be retransmitted through sexual transmission. So focusing there will also help care for those people and help from a public health perspective.
How high is the threat for reinfection?
Well, I'm not an expert in reinfection itself. But we do know that that our initial estimates of how long the Ebola virus, for instance, exists in semen was an underestimate. It's actually much longer, and we're still learning exactly how long it can last. But certainly beyond the 90 days we initially thought, and several more months after that. So continued monitoring is also going to need to happen, and that's not going to come from anything but actually providing health care to these Ebola survivors.
Okay, what are the lessons that you think we can take from Ebola and now apply to Zika in terms of protecting those countries that are already infected and the United States as we head into the warm weather months and at least 200 million people are potentially in areas that could have Zika outbreaks before the end of this year. What are the lessons that you would have us take from that, and what kind of action should the United States take in order to deal with that potential threat?
Yeah, well, I think that the effort to bring in capacity to detect early, respond quickly, and then prevent these things from coming back is critical. So health workforces are important. The training's important. The lab systems are important. Vaccine delivery and creation is important. I think we need to also remember that 75% of emerging human infections start as zoonotic zoonotic origin. That means that they are coming from animals to humans. They may spread human to human in some cases, as Ebola does primarily, but and those are happening in remote parts of the world. You know, Zika itself was discovered initially in a forest in Uganda in the 50s. So, you know, can we detect these earlier in those remote parts of the world to identify the next threat that we don't even know about yet?
Well, I'm just going back to what you said earlier about how we had to move in minutes and we were moving in months, in years.
Yeah.
Do you feel that there's a sense of urgency here? Dr. Knight, could you talk about that in terms of the lessons of Ebola, given the fact that Zika is on our border?
Well, I think, you know, the lesson is how would you work with the private sector? I mean, this sort of reducing the response time from months to minutes. The private sector is already established in those places. You know, it's an email, it's a phone call, and it's a request, and we can mobilise because we've got systems and logistics there. You know, what can the private sector do? It can talk to everybody who works for them. It can talk to everybody who supplies them. It can talk to their neighbours. And if every single big, medium-sized company in those infected countries was doing that, it makes a big difference. You know, you have a very special relationship in an employer-employee relationship.
Well, how do you feel about this transfer of funding out of Ebola and over to Zika at this time, Dr. Knight?
Well, it's hard because, as you sort of said, it's sort of it's a bit of a moral maze. But if the question is, have we done enough to stop Ebola happening in Liberia? Have we done enough to create the right momentum towards economic recovery in Liberia? The answer is no. Mm-hmm.
Have we done enough to put in place the protections that we need against Zika, from your perspective?
Well, I'm not close to Zika, so it's not fair to sort of push.
Dr. Delaunay, how do you feel about that?
MSF is not working in the countries where affected by Zika either, so I'm not really able to answer your question, but I can just say that indeed there's still a lot to be done for Ebola, both in terms of system strengthening and research to understand this disease. And if it's about shifting from one priority to another, then it's worrying, because this is one of the lessons that we learned from Ebola, that we need to be prepared. It's going to come back, and science needs to go on.
Yep. So your basic message is to fund Zika at the levels that it should be funded, but don't underfund Ebola as a result of making that choice, almost a Sophie's choice between the two diseases and the impact it can have on families?
Absolutely. Absolutely, yes. There's still a lot to be done on Ebola. And our big concern is that when the cameras have left these countries, and there are still lots of lessons that can be implemented, especially in terms of, because it's not just about funding, it's also, as Amanda was saying, you know, trying to be more effective with the funding that we do. And in the field of science, it's clear that one big lesson is being prepared and being organized to gather that data, to share knowledge, is going to improve the scientific advances.
Thank you so much. Thank you, Mr. Chairman, very much. I'd like to again come back to this Zika question. I think it's very important because there's clearly a dynamic tension now that's opening up in terms of the willingness of Congress to appropriate the monies that are going to be needed to deal with both of these diseases. Maybe you, Dr. Panjabi, maybe you could talk about this issue again in terms of the need to ensure that there is funding for the Zika epidemic as it moves throughout that region and towards the United States at ever accelerating pace. What would you recommend that we put in place given the lessons that we've learned from Ebola? And would you recommend to Congress that they replenish the money that they're taking, that we could reprogram out of Ebola, and ensure that there is at the same time full funding for Zika, so that we don't, unfortunately, lose the lessons of the Ebola crisis, lose all of the, you know, the basic hard-won human tragedy that had to be suffered through because we didn't act quickly enough, because the world didn't respond quickly enough, because the WHO did not respond quickly enough. What would you recommend to us as an institution in terms of the funding and how we should proceed?
Well, the way I think about this is these are not separate battles in a single war. You can't win one or the other and win the war. These are two different wars to fight. And we have to be able to maintain our defenses on both fronts, whether it's in West Africa or in Latin and South America now, in the Americas. So I do think whatever can be done from the Congress perspective to both provide the support that's needed to respond to Zika and, where needed, replenish, if that's what's needed, the funds that are being moved away from Ebola, but also actually, again, tie that to performance. I mean, there are clear targets here of what's needed to be done. These are, we need to get kids vaccinated in West Africa. We need to make sure that community health workers are paid and supported. Lab systems need to be strengthened. Health worker readiness needs to be there. They need to have protective gear, gloves, and gowns. If we continue to do that in West Africa, we will help stop the next threat there. Some of those same lessons and interventions are what's needed in Zika, whether it's training health workers, equipping them appropriately. And I think the global health security agenda that the CDC has put forward is very straightforward. Prevent, detect, respond. That kind of agenda of investing in that will be very helpful. We also know that Zika has been present, as I mentioned earlier. The first cases were in West Africa and Nigeria of human infections, right? So by investing now post-Ebola, or while we're trying to fight Ebola still, and also recover, but also set it up to be resilient against Ebola in West Africa, we're also setting it up to be resilient against other kinds of diseases if we do it the right way, whether that be Zika, if it reemerges there, or whether it's other infections. So
So as you look at WHO and what just happened with Ebola, have they learned the lessons, in your opinion, Doctor, of what just occurred in West Africa?
I do think the WHO, a well-supported, fit-for-purpose WHO, is going to be important to helping stop and respond to these outbreaks. I think they play an essential role. Have the lessons been learned? I think they're still being learned. I think that.
What do you think the big problem was, Doctor? Why didn't they see it? Why wasn't the alarm bell ringing so loudly that they did not respond? And why, in your opinion, should we have any confidence that any reforms are going to change that attitude?
I think the central primary reason is that this went undetected, right? As I mentioned in the testimony, you have an Ebola infection that moves from an animal reservoir into a human reservoir, a human population initially, in really remote areas. Health workers are not supported there. They're unpaid or they're underpaid. They're unequipped or under-equipped. And if you don't have a health system in these remote areas, you're going to miss. It took 3 months. When minutes counted, every minute counted, we lost months. So by the time March rolled around of 2014, to catch up with that response we were already behind several steps from the epidemic. So I think that still is the central issue, is making sure surveillance and primary healthcare services in the most remote areas are there. That includes good data and monitoring. Had those pieces been in place earlier on, any institution, whether it was the governments in those 3 countries, the WHO, the US government, they all would have been better prepared to respond. And again, I think that is the focus now that needs to be there for all of us, is to make sure where we know there are disease hotspots likely to happen and there are blind spots in healthcare reaching those areas, we need to double down on investments in those places.
Thank you, Doctor.